Chapter 5, Eating Behaviors, Food Choices, Trends, Programs, and Policies educational video based on Introduction to Health Promotion, 2nd edition, Chapter 5 by Maya Maroto. All rights to the original text belong to the author and publisher. Produced by Mastering Public Health. Welcome to Mastering Public Health. In this episode, we explore Chapter 5, Eating Behaviors, Food Choices, Trends, Programs, and Policies. Poor diet is now one of the leading causes of premature death worldwide. In fact, it contributes to more deaths each year than tobacco smoking, roughly 11 million globally. In the United States, most adults fall short of meeting the dietary guidelines for Americans. Our challenge as health promotion professionals is to understand not only what people eat, but why they eat it, and how environment and policy shape those choices. Learning objectives. By the end of this chapter, you should be able to explain the major drivers that influence food choice, describe the links between diet and leading chronic diseases, discuss national dietary guidance and patterns of consumption, analyze changes in the American food environment, identify current nutrition policies and programs promoting healthier eating, understand how ecological and policy level interventions create nutrition security, global and national context. Poor diet is now recognized as the leading global risk factor for premature death. Worldwide, it accounts for roughly 11 million deaths every year, surpassing tobacco as a cause of mortality. In the United States, diet-related chronic disease continues to rise, and most adults do not meet the recommendations outlined in the Dietary Guidelines for Americans. Public health experts now emphasize nutrition security, defined as consistent access to foods that are affordable, available, and health promoting. Nutrition security builds on, but goes beyond, food security by focusing on dietary quality, not simply calorie quantity. Addressing diet-related disease requires an ecological approach. Effective health promotion must target change at multiple levels: individual behavior, community environment, and public policy, so that healthy eating becomes the convenient, affordable, and socially supported choice. Section 1. Understanding food choice. People make hundreds of food decisions every day, most of them automatic. These decisions are influenced by many non-health factors that go far beyond nutrients. Taste remains the number one driver. Humans are biologically drawn to foods high in sugar, fat, and salt. Modern ultra-processed foods are engineered to be hyper-palatable, combining these flavors in ways that reinforce overconsumption. Emotions also play a role. Stress, boredom, and comfort eating can drive preference for calorie-dense foods. Price is a critical determinant, especially for low-income populations. Energy-dense processed foods often provide the most calories per dollar, while healthier options like fresh produce and seafood cost more. Convenience and time shape modern eating habits. The rise of ready-to-eat meals, online grocery delivery, and takeout reflects how busier lifestyles influence diet quality. Culture and familiarity link food to identity, memory, and community. Interventions must respect cultural preferences to be effective. Environment determines access. In the United States, millions live in food deserts with limited access to healthy foods, while others live in food swamps, areas saturated with fast food outlets and convenience stores. Marketing powerfully shapes preferences, especially among children. Advertising often targets youth with promotions for sugar-sweetened beverages and snack foods, disproportionately affecting lower income and minority populations. Section 2. Nutrition, Eating Habits, and Health. 5 of the 10 leading causes of death in the United States are directly related to poor diet, including heart disease, cancer, stroke, type 2 diabetes, and obesity. Heart disease is the leading cause of death. Diets high in trans fats, sodium, and refined carbohydrates increase risk, while diets rich in fruits, vegetables, and whole grains are protective. Cancer is second. High consumption of processed meats, refined grains, and alcohol increases risk. Plant-based diets lower it. Stroke ranks fifth. Diets like the Mediterranean and DASH diets, which emphasize low sodium and high potassium, reduce risk significantly. Type 2 diabetes is strongly linked to obesity and poor diet quality. The Diabetes Prevention Program shows that lifestyle modification can prevent or delay disease onset. Obesity rates have soared from 13% in the 1960s to more than 40% today. Modern research shows that obesity is not just about calories in versus calories out, but also involves hormones, stress, sleep, and exposure to hyperpalatable processed foods. Section 3, Dietary Guidelines and Patterns. The Dietary Guidelines for Americans, DGA, are updated every 5 years by the USDA and HHS. They provide science based advice for promoting health and preventing chronic disease. The consumer friendly resource MyPlate translates these recommendations into action. It encourages half the plate to be fruits and vegetables, a quarter grains, preferably whole, and a quarter lean proteins plus dairy on the side. The DGA emphasizes increased consumption of whole grains, fruits, vegetables, and lean proteins, limiting added sugars, refined grains, sodium, and saturated fat. Dietary Patterns Through History Barry Popkin describes 5 global dietary stages. First, hunter gatherer, high fiber, diverse, nutrient rich. Second, agricultural, dominated by grains, low variety. Third, industrialization, rise in animal protein and processed food. Fourth, westernized diet, high in sugar, saturated fats, and refined foods. Fifth, desired pattern, balanced diet aligned with MyPlate and DGA goals. Section 4, the changing American food environment. Since 1970, total calories available in the food supply have risen sharply, mainly from refined grains, oils, and added sugars. Grains. Consumption increased, but most are refined rather than whole. Fruits and vegetables. Availability improved, but most intake comes from processed forms like French fries and pizza sauce. Dairy. Milk consumption dropped while cheese consumption doubled. Protein. Chicken intake rose, red meat declined, seafood remains underconsumed. Added sugars and fats. Sugar sweetened beverages are still the leading source of added sugars, though consumption is slowly declining. Eating away from home. Americans eat more restaurant and takeout food than ever, which tends to be higher in calories, fat, and sodium. Portion sizes. Portion sizes in restaurants and packaged foods have doubled or tripled since the 1970s, fueling overconsumption. The food industry heavily markets low nutrient, high calorie products, particularly to children. While voluntary initiatives like the Children's Food and Beverage Advertising Initiative (CFBAI) aim to self regulate, critics question their effectiveness. Farm subsidies also play a role. Commodity crops such as corn and soy receive the majority of federal subsidies, lowering the cost of processed foods relative to fruits and vegetables. Section 5, Policies and Programs to Promote Healthy Eating. Modern nutrition policy focuses on nutrition security, ensuring consistent access to affordable, health promoting foods. Federal policy actions. Biden Harris National Strategy on Hunger, Nutrition, and Health 2022 aims to end hunger and reduce diet related disease by 2030 through 5 pillars, improving food access, affordability, and education. Menu labeling. Chain restaurants must post calorie information. Trans fat ban. Industrial trans fats removed from the food supply. Nutrition facts label. Updated to include added sugars. Women, Infants, and Children program provides supplemental foods and nutrition education. Packages now align with the DGA. SNAP Supplemental Nutrition Assistance Program. Ongoing debate about nutrition standards for purchases. GUSNIP incentivizes fruit and vegetable buying, state and local policy. Medically tailored meals. Pilot programs in California and other states integrate nutrition into Medicaid services. Urban nutrition standards. Cities like New York implemented sodium warnings and nutrition labeling. Health bucks, local incentives for SNAP users to buy produce at farmers markets. Community initiatives. Healthy Corner Store Initiative, the Food Trust, converts convenience stores to stock fresh produce. Healthy Food Financing Initiative, HFI, funds supermarkets and distributors in underserved areas. Worksite wellness. Employers increasingly promote healthy food environments through policies like healthy vending, cafeteria nutrition labeling, and education. These efforts improve productivity and reduce healthcare costs. School nutrition. The Healthy Hunger Free Kids Act of 2010 sets stricter standards for school meals and vending options. Schools now serve more fruits, vegetables, whole grains, and low fat dairy, creating healthier habits early in life, individual level interventions. Registered dietitians provide counseling in clinics, workplaces, and even supermarkets. Tailored nutrition education has been shown to increase fruit and vegetable consumption and reduce BMI. Section 6, The Path Forward, Creating Nutrition Security. Health promotion requires an ecological approach that addresses food systems at every level, from individual behavior to public policy. Nutrition security depends on: first, consistent access to healthy foods; second, affordable pricing relative to unhealthy alternatives; third, supportive environments in schools, workplaces, and communities; fourth, policies that align agricultural incentives with public health. The ultimate goal is not just preventing disease, but creating environments where nutritious food is the easy, affordable, and preferred choice for everyone. Conclusion: poor diet is now a leading global health threat, but it is also one of the most modifiable. Health promotion professionals must link behavior change theory with systems level change, integrating education, environment, and policy. The future of health promotion lies in nutrition equity, ensuring every person, regardless of income or geography, has access to affordable, nourishing food that supports lifelong health. Educational video based on Introduction to Health Promotion, Second Edition, Chapter 5 by Maya Maroto. All rights to the original text belong to the author and publisher. Produced by Mastering Public Health.